everyone. You're listening to Alternative Revelations with Linda Emanuel. And this is podcast number 61. This is the big one about the mild silver protein. An interview with Dr. Jim Taylor, all the way from Savannah, Georgia, and Mexico. So I must, usually I say this disclaimer that I am not a doctor, nor am I a medical practitioner. I cannot give medical advice. These podcasts are for informational purposes only. But now we have a doctor on board. This is so exciting. He is helping so many people get well. He has lots of stories to tell. He's a most interesting guest. And he's going to tell us about some of his cases and when he started using the mild silver protein. And I'm going to turn the mic over to Dr. Jim Taylor.
Okay. Thank you, Linda. I'm glad I'm back with you to talk about mycoplasma. Just to give you an idea about mycoplasma, similar to stem cell research, both mycoplasma and stem cells are relatively new in the medical field as far as research and even the utilization of the treatments, whether we're talking about stem cells or mycoplasma. And if you would look at the curriculum of probably any medical school in the United States, there's probably more stem cell curriculum now than in the last 2 or 3 years than there have been in the last 40 years. And the same goes for mycoplasma. If you talk to a doctor about mycoplasma or stem cells, they don't know, or they don't have as much information as they should have, simply because it wasn't taught to them in medical school. So having said that, one of the things that we've done in Isla Mujeres, Mexico, where our stem cell research clinic is located, is that we looked into the mycoplasma after talking to Linda and some of her associates that had dealt with mycoplasma and colloidal silver therapeutics. And after doing 2 or 3 years of research, we came up with a protocol that we feel is really working well with a number of our patients for a number of conditions. If you remember earlier, we have completed 72 stem cell clinical studies using the patient's own stem cells. And by having that many different clinical studies to fall back on, we have developed protocol for a number of those conditions, whereby we use the colloidal silver IVs as an adjunct to removing some of the mycoplasma and the other proteins and irritants that are in the body that are causing a number of the conditions that exist.
Okay, now I have a question. Let's say I have Alzheimer's or Parkinson's, and I came to you for stem cell therapy, thinking that would get me well, and that does help the body rejuvenate or regenerate. But what would be your protocol, or what would be your procedure to treat somebody with a mycoplasma infection? What would you do first?
That's a really good question, and I've got a number of patients that we are treating with colloidal silver IVs as an adjunct, and one comes to mind. She's a nurse. She was a midwife for 25 years. Super intelligent lady, and 10 years ago she was diagnosed with Parkinson's. And she came to see us in Mexico about 4 years ago, and she began treatments and continued treatments for 2 to 3 months, and then she stopped her treatments. And then in August of 2019, she contacted us again and asked that she be able to begin stem cell treatments, and started in August. She in the last few years, she continued to digress with the conditions that are related to Parkinson's. So we have been treating her with her stem cells, and about 2 months ago, we had a conference with her and explained to her what we believed would be a good protocol to help enhance the stem cell regeneration that was going on in her body with her stem cells. And she agreed to do this. So we initiated a colloidal silver IV protocol with her about 8 weeks ago. And one of the drawbacks with, and it's really not a drawback as such, as it is just during the kill off, you go through the Alzheimer, and sometimes those are pretty significant. When you're dealing with them for the hour or two, you think your teeth are going to chatter out of your head because of the kill off of the mycoplasma. But that's just a byproduct of what's occurring. And she went through the treatments with the colloidal silver, and has, in the last 2 months, now completed 7 colloidal silver IVs. And the great thing about her, it not only is she's educated, but I call her a talking, one of my little talking guinea pigs, because they can relate back to us what they're feeling and what's going on with their body, because she has a background of anatomy and physiology, and she has a working knowledge of what's going on with her neurologically and systemically with the condition that she's been dealing with for the last 10 years. And that's information that you can't buy or pay for, to have someone like that. And she is most excited about adding that adjunct to her stem cell therapeutics. And she believes, and has related to me on a number of occasions, that she believes that adjunct added to her therapeutics has made a significant difference, which to me is really important, especially if you're dealing in research of what and how things occur and what can make a condition better or dissolve a condition to normalize, regardless of whether it's neurological or systemic or organic. So that's been exciting, not only for her as a patient, but also for us to see the results that the colloidal silver therapeutics has, as an adjunct, has added to her treatment protocol.
So just for your information, the Common Cause Medical Research Foundation has proven that Parkinson's is a mycoplasma infection, along with Alzheimer's and Lou Gehrig's disease and multiple sclerosis. I do have the list of diseases, I believe, on my website that are caused by mycoplasma. Another example, if I can be so bold, Dr. Taylor is treating somebody with prostate cancer, and prostate cancer is another mycoplasma infection, as are most other cancer. They're all mostly, the most common cause of cancer is mycoplasma. And mycoplasma is spread through the sharing of body fluids, and also when you're sitting on an airplane with a lot of sick people, you're breathing in the mycoplasma, but the mycoplasma does not activate unless you have some kind of extreme stress or trauma, which triggers it to awaken. And mycoplasma lay dormant in a degenerative cell, waiting for an opportune time to activate. And mycoplasma does have a purpose. I like to tell people that mycoplasma, when the host, it's a total parasite, and when the host is dead, it's called decomposition, and when the host is alive, it's called cancer or disease. So, Dr. Taylor, would you like to talk about the results of your prostate cancer patient?
Yeah, the patient that has developed the prostate problem has come to us, and he's received a number of treatments. He had gone to the proctologist and a urologist, and they had performed biopsies, and they came back positive. So basically, what they gave him as an alternative is to do the the prostatectomy and to undergo chemotherapy and radiation. And he, again, the advantage to him is that he's educated. He's a naturopath. He's an acupuncturist. He's been in practice for 30 years, and he's 67 years old. One of the problems that he was dealing with is low testosterone. His testosterone was 270, and so if you look at a lot of the research or a lot of the treatments, a number of prostate problems are attributed or are said to be attributed to a testosterone level, but it's usually the high testosterone that is afforded the problem that develops in the prostate. And I believe that a lower prostate problem can be as detrimental as a higher prostate, even more so. I think if even a middle-aged man or one who is 67, as this patient that we're talking about in particular, has a low testosterone level, I think one of the things that should be considered is to increase that testosterone as soon as you can do something with the prostate. Now, having said that, his PSA went from 4 to 6 to 8. So, and then once it hit 8, he came to see us, and he has, in the last 3 weeks, undergone a number of colloidal silver IVs. I believe either 3 or 4, maybe 5. I'm trying to remember this from rote memory. 5, and we sent him back we did a blood test for his PSA, and it had dropped from 8 to 6. So and he has done nothing other than the colloidal silver. And at the moment, we're not treating him with stem cell therapeutics. We're treating him only with colloidal silver and vitamin C IVs. So, and I believe that if he continues this for the next 4 to 6 to 8 weeks, that you can see another drop in his PSA. And if that does occur, then he needs to reconsider his alternatives as to what he wants to do as far as undergoing surgery and chemo and radiation. Because once it's cut out, it's gone. And if you can do something to normalize the activity of the prostate, you're far better off keeping it than sending it out.
Okay, Dr. Taylor, did you know that the enzyme nagalase is a cancer marker and that mycoplasma is the one that produces nagalase? And nagalase was discovered in autistic children by Dr. Bradstreet, and that's where Dr. Bradstreet made the connection between autistic children, and mycoplasma and the GC-MAF. And I did do a podcast on autism, GC-MAF, explaining how GC-MAF worked, and mycoplasma and nagalase. So did you ever think about, and I'm not telling you how to run your practice, did you ever think about looking at the nagalase markers?
Well, I'm familiar with the nagalase markers, and one of the clinical studies that we performed was related to autism, and we received good results with the patients that received the stem cell therapeutics in that clinical condition. What we haven't done to date, but what we plan on doing, is to implement the colloidal silver IVs with autistic patients that will come to see us for stem cell therapeutics. And I believe that by using the colloidal silver IVs as an adjunct before we start with the stem cell therapeutics, that you're going to go through a detoxification and a cleansing, if you will, of the body, which I believe is going to increase the productivity of the regenerative process of using the patient's stem cells for regeneration. And another one of the things that we've seen with not only prostate but autism is oxidative stress and a reversal of oxygen carbon dioxide ratios. You have to have a certain amount of carbon dioxide in your body, but if you have too much carbon dioxide and not enough oxygen, and usually if you have a low oxygen level, you're going to be acidic. So your pH is important to be more in an alkaline state, and your oxygen carbon dioxide ratio is important to be in an oxidative state. And one of the prerequisites that we do as an adjunct is we make sure that the patient becomes alkaline and has a sufficient amount of oxygen.
And mycoplasma lives in the perfect state for mycoplasma to live in is 5 to 6.8, which is acidic. Now, Lyme disease can live in an alkaline environment, which makes it really bad. And Dr. Taylor knows this, but I've seen silver IVs given to Lyme victims, and oh my gosh, the mild silver protein really knocks out Lyme. I don't know if you've had a chance to have patients with Lyme, but compared to what doctors are charging on these clinics for Lyme, hundreds of thousands of dollars, and are not getting people well, where a colloidal silver or mild silver protein IV is very reasonable alternatively. It's really not expensive. We won't go into prices, but it's affordable compared to what the allopathic medical industry is charging for even prescriptions. So I'm hoping that you are learning something about mild silver protein. It is what I call, this is my own term, I call it a quick fix. There's lots of ways to kill mycoplasma, many roads to ways to kill it, and they're all on my podcast, How to Kill Mycoplasma, and I hope to always give you interesting stories along the way. So I'm going to ask Dr. Taylor if there's anything else that he wants to add about the mild silver protein. He did mention in the podcast before why he believes the silver kills the mycoplasma. And remember, mycoplasma is encased in a membrane made of a lipopolysaccharide. It has no cell wall, so it is a perfect bioweapon weapon. It is not affected by antibiotics, and it can live around 7. It doesn't like alkalinity. In fact, you can kill it by alkalizing the body. But again, Dr. Taylor, do you have any ending words?
Another thing that we've discovered when coming up with the methodology that we derive to pull stem cells out of blood is it just stood to reason that if you can pull stem cells out of blood, you should be able to pull testosterone out of blood, and you should be able to pull estrogen and progesterone out of blood for females, rather than having to use synthetic testosterone for males or synthetic progesterone or estrogen for females. Having said that, what we did is we derived a methodology whereby we can actually pull testosterone, which is natural testosterone, from the blood, and utilize that in lieu of synthetic. The issue with synthetic testosterone is that by a continued use of synthetic testosterone, it tells the hypothalamus that there's testosterone there in the pituitary, and then they in turn tell the testicles to stop producing natural testosterone. So over a period of time of utilizing synthetic testosterone, a male's testicles will actually stop producing testosterone. With natural testosterone, you don't get as quick a result as you do with synthetic testosterone. However, by using natural testosterone, it stimulates the pituitary, the hypothalamus, to tell the testicles to actually start producing testosterone. So even though you may be 40, 50, 60 years old, as we've alluded to some of the patients that we've dealt with, if you utilize the natural testosterone in lieu of using the synthetic testosterone, over a period of time, your testicles will actually start increasing natural testosterone levels, and your testosterone level will go up. In the same respect, that happens with females, with estrogen and progesterone. So, if a woman is using synthetic progesterone or estrogen, I think I alluded to the fact that estrogen and progesterone, the base that pharmaceuticals use to produce that is female horse urine. I don't know if you know that or not, but now you do. So rather than use estrogen and progesterone that's derived from female horse urine, I believe that a female is much better off to use her estrogen and progesterone in her blood to stimulate the ovaries or the uterus to produce natural hormones. And if they do that, and we've had really good results on both male and females with hormone replacement therapy, they're going to be much better off because they're using their own. And this goes back to what we said in regards to the stem cells. You're much better off using your tissues and your blood and your hormones than you are using foreign tissue.
Okay, Dr. Taylor, can you tell our listeners what other protocols or what other therapies you do down in your clinic?
Well, just to mention a couple, we also use hydrogen peroxide IVs. We use vitamin C IVs. We use cannabis treatments with various diseases, and including carcinomas. We have a weight loss program, but initially, when you come to see us, our interest is where you are, why you are there, and what we need to improve your way of life. So this is not just a quick fix that we look at. We go through and we look at your blood work, and we look at your physicality and your mentality as to where you are emotionally with the conditions that a patient's dealing with. And we have people who are concerned about the patients that come to see us, because usually when they come to see us, they're looking at a last resort. They've already gone through the medical regime of whatever they've had to deal with, and they haven't gotten what they consider to be appropriate care that has remedied the condition that they're still dealing with. So having said that, we make every effort that we can to look at the person as a whole, and to make a determination about what it is that they're dealing with as an individual, and not as someone who, like 100,000 or 50 million people in the United States having diabetes, but what their condition is and the condition that they're dealing with, and what we need to do for that individual to alleviate those problems in that condition. And once we've done that, then we talk with the patient about what we think is going to happen, where we think it's going to go, how we think it's going to be, and what results we believe that we're going to get from it. And so, in essence, it's a change of life for that patient. They're not coming to get a quick fix or an aspirin or a pill so that they can go ahead and continue to go to McDonald's and or Burger King or continue to do whatever they were doing that developed that condition in the first place. So having said that, we try and we feel that we are fairly successful in dealing with patients not only on an individual level, but as on a holistic level, so that we can help them not only improve their longevity of life, but also the quality of life that they're going to be living for the next 50 or 100 years.
Oh, that was really nice. Dr. Taylor is really a great humanitarian. He's very. Are you humble? I guess you're humble. He has a sense of humor. So we've been really good through these two podcasts. We haven't been joking around. He's a great person to meet. I hope someday you get to meet him like I have. He's a wonderful person. I'm kind of going to get him a little ego trip here. But I'm just so thrilled that you came up to St. Louis, all the way up here to this little dinky town. We're not really a big city, but we're so glad that you came up to visit us. And I hope this was educational. Again, it's all about educating yourself. And one of the things I try to do is I explain why and how and what. And that's what Dr. Taylor does. He knows all about mycoplasma, how it works. And that's the big thing with the medical industry. You go to your doctor and you say, what is causing this? And they go, we don't know. I mean, that is a horrible thing to tell your patient. I mean, they're telling you the truth. But Dr. Taylor tells it like it is. He knows all about infectious diseases and cancer. And I really do believe he's got his heart in it too. He's not a money grabbing, take all I can. He's really caring and wants to get people well. And a great humanitarian. He's really high on my list. So this is going to conclude this broadcast or podcast. I hope it was educational. I hope all my podcasts are educational. And I will eventually be putting Dr. Taylor's link to his website. We haven't had a chance to start building it yet, but I'm really excited about what he's doing with the stem cell therapy. It was very educational for me because I did not know anything about it. And I did learn a lot, about the umbilical stem cell and about the donor and about your own stem cells. And it just makes all total sense. All my podcasts are about logic and common sense and answers to why, what, and how. So I don't know what my next podcast is going to be about, but it will be about something interesting. So I hope this was educational, and I hope you learned something. Try to, when Dr. Taylor gets his website up and running, I hope you go visit it. I will post his website on all my podcasts in the past. I'll just go through and edit them. So until next time, good night and God bless.